Good evening, ladies and gentlemen. We are back with Two Box Talk with She Masters. My name is Masoko Lokoe, and I'm your host for tonight. Welcome, welcome, welcome. Today is a day where we're going to be talking occupational health. Last week, on our last episode, we discussed what occupational health safety is. And we broke all the disciplines of occupational health and safety, trying to explain them, what they are, what they look at, and so forth. So today, we are simply going to be looking at occupational health, going deeper now into occupational health. And before we start, I'd like to invite you to share the watch party, to start watch parties, to share this episode with your friends and family. Invite as many people as you can, so that they can also hear what this industry is all about. So I'm very pleased today to welcome our guest, who is Mr. Thabo Musipi, who is coming from a company called Stockport Health, which is the pioneer for occupational health service sector. When we talk about occupational health, we are talking Stockport Health. They are going to be explaining to us, coming with us, and explaining to us what this area of occupational health is all about. Welcome, Mr. Tabo. Welcome, welcome, welcome.
Thank you, Masero, and good afternoon.
Good afternoon.
Um,
Good afternoon.
yeah, thank you for inviting me to your show today.
You are welcome. You are very much welcome. So before we start, I'd like us to look at occupational health, what occupational health is all about, because you are the pioneers of this industry, you are the pioneers of this sector. Can you please tell us what occupational health is all about?
Okay. Basically, people are used to it being occupational health and safety. So I'll say it's, in a nutshell, it's an interdisciplinary activity that is mainly concerned with the prevention of occupational risks or hazards that are inherent to each work activity. Basically, the main aim of occupational health is to promote and maintain the highest degree of safety and health in the workplace. So, therefore, creating conditions that avoid the occurrence of work-related accidents and illnesses.
Mhm.
So, in a
Great.
nutshell, occupational health is that disciplinary activity that mainly exists to prevent the occurrence of occupational illnesses and occupational accidents in the workplace.
Occupational illnesses, the occurrence of occupational illnesses and
Accidents.
Hi, Tabos. Sorry about that. I just had technical problems there. It happens. Thank you very much for waiting. Yes, you were talking about occupational health discipline as it entails, addressing of occupational injuries and, ill health, prevention of occupational injuries and ill health. Indeed. So,
Yes.
Motswana Bohaya or whoever that is watching here would want to understand, like, so when we talk about occupational, we are talking about the workplace, like you said. So most of the time, we address workplaces as, me going out to work, in those big industries, in those big sectors. But I believe occupational, we entail everybody that lives going to work. It doesn't matter whether it's at home, it doesn't matter whether it's at a big industry or the bank or whatever or the school. Everybody, as long as you live, you go to work, you are going, that is your occupation. Even at home, because we have people who are working from home. Now, let us look at this now, the what happens in occupational health. Firstly, let us look at the, you know, as an employer, I want to start, making sure that I care for my employees. Okay, so what is it that I have to do as far as occupational health is concerned? Now that we are coming back from the holidays, and a lot is happening in terms of COVID and the other things that are happening in terms of occupational health and safety, and we have new people maybe who are being employed in terms of occupational health. What do I do? What am I expected to do as an employer?
All right. Thank you for that question, Masego. And I think again, I'm happy that you alluded to the point. Whereas in the center, when you talk about an employer, who exactly are we talking about? I think quite often we tend to classify employment mostly to the formal sector. We normally tend to forget those that are in the informal sector. So in this instance, occupational health cuts across from your informal sector to the formal sector. For example, I know when I come to work, I leave my helper at home. For me, that's home, but for my helper, that's at work. So the question is, now I'm an employer in that instance. What do I need to do? That's where it starts. It starts from our homes. It starts with us having to accept that even at our homes, um, that's someone's workplace. So the other thing, before I can actually answer to your question, is to look at the current situation that is happening, where we are faced with a pandemic in the name of COVID, where it has no place or no description of a place where you can get it. We can actually get it anywhere. And interestingly enough, it has since been classified as an occupational health disease. So now that has brought the shift to say now occupational health, we all as employers need to start thinking very seriously about application of occupational health in the workplace, starting from our homes, which happens to be some people's workplaces. So like we said, the whole purpose or the whole aim of occupational health is to promote and maintain the highest degree of safety and health in the workplace or at work. And for us to achieve all this, the employers need to understand one, we need to get um, to adopt the culture of where we have to work with conducting risk assessments regarding the safety and the health at work. That is starting from home. If I get home, fine. At work, I'm always putting on the mask. But if I get home, I put away the mask. I interact with a lot of people here at work. But then when I get home, I'm going to interact with my worker or my helper, who also happens to be at work. I'm going to have my guests who actually come visiting me, but to my helper, they're actually clients, because one or the other, or by extension, they're still going to have to extend the service to them. So in that instance, as an employer at home, I need to start just by doing, the risk assessment wherever I am. And then with the risk assessment, this is what will actually help us decide on the actions that are required and what kind of occupational health safety measures that we could implement. Um, let's take, for example, the other thing again, especially when you go back into the formal sector, like we just said. Um, Especially in the mining industry. I think that's where occupational health is mostly been common. We have a lot of people by long that are getting hired. So as people get hired, the most important thing nowadays is to establish the I would say the baseline for their health. You know, to say, okay, as I bring this person into my workplace, what is their health status as at present? Therefore, in that instance, this is where we start. We need by start doing only the medical examination. That's part of the assessment. Remember, I spoke about the workplace. The workplace does the environmental assessment. The environmental assessment is the one that will tell you, okay, what measures do I need to put in place? And then after that, now it goes to the employee, because remember, it covers for both the environment, the employee, and the employer. Now it goes to the employee to say, okay, as a present, when I bring you into my company, what is your health status? That brings about the issue, the medical examinations. So it's something that has been lagging behind, but we need to find a way where we know whoever that we bring into our employ, we know their health status. That will help in protecting the other co-employees that they find. It will help in protecting our environment for our customers. It will also help in protecting us as the employees. But then again, going back deeper into your question, what exactly should as the employers do? I think the key thing that we're supposed to do, there are actually about 4 or 5 things that the employers need. We need now to adopt to the culture of doing. We need to, as employers, make sure that first and foremost we have the occupational health and safety programs in place. So these programs will actually help us to identify the hazards in the workplace and determine the risks associated with them. We also need to this programs that we come up, they need to be in a position to help us design the management programs that will help reduce the risk associated with whatever hazards that we find in our workplace. So the other second thing that's very key for us as employers to now start um, having and monitoring very seriously is having your health and safety policies and procedures. So these are the policies that will clearly provide guidance and approaches that we adopt as an employer to deal with those identified hazards, and also clearly guide and communicate what we expect from our employees in dealing with whatever occupational hazards that might be found in the workplace. The other important thing, again, I'll talk about now drawing it closer to the current situation that is happening. We have an issue of adherence versus compliance. So for us having these documents or these guiding documents that I just spoke about, the Occupational Health and Safety Program, the health and safety policies and procedures, will also now, as employers, need to start seriously monitoring the issue of compliance versus adherence. Why am I saying this? Majority of companies, from experience, we've noted that they do actually have these documents, but we do have these documents mainly for compliance. But remember, when you just do compliance without maintaining a balance with adherence, you're actually creating red flags, or you're not really solving any much. Because you're going to comply. Let's take, for example, right now, what's happening here in Botswana, where we're told, oh, you can't get into a public place without putting on a mask. So what people often do, we just put on a mask so that I can get access into the shop. But once I get into the shop, then how do I go about with that mask? I pull the mask down to my chin. So in that instance, I was compliant. I managed to get into the shop. And then some shops, they actually allow people to say you can't enter without a mask. But do they monitor that we properly use those masks? In that instance, what do? They actually focus mainly in the compliance part for the purposes of them to continue operating without creating friction with the law. But what's important, now we need to start adopting the culture of monitoring adherence, or maintaining a balance between compliance and adherence to these policies and guidelines that we put in place. And then probably the last one, like we appreciate that occupational health, I think, what do you call this? COVID now it's been classified as an occupational health disease, and currently it's hitting us hard. Probably this is the time for employers to start thinking of probably introducing or finding ways of coming up with your occupational health insurance plans for their employees. This will help to safeguard their employees, or whatever outcomes that might happen due to whatever occupational health due to whatever occupational health eventualities that they might encounter from work. It will actually help to cushion for even the employer. Let's take, for example, where you are faced with issues of your compensation. You are faced with issues to the lawsuits because I got injured from your workplace and blah blah blah. These are things that for one, if you don't have such insurance plans or policies in place, they can actually cripple your business. So as occupational health practitioners, that's where we come in, to say, okay, as the employer, how do we help you? How do we help to protect you against any occupational health eventualities that can cripple your business? And then over and beyond, how do you help you to maintain a happy client or employee?
Wow, wow, wow. Thank you very much. Thank you very much about of what you just said. That was a really a mouthful. This is Toolbox Talk with She Masters, where we are talking occupational health, about occupational health. Mainly, we are saying that caring for the carer and occupational health perspective. Feel free to invite as many friends as you can. Start watch parties everywhere you are. Feel free to do that. So, Tabo, you've talked a mouthful about, the medical exams, adherence, and compliance. But let us look at this one, caring for the carer. Mainly when we talk about carers, we are actually looking at, maybe the health sector, those people who are being in the health sector, looking after those ill patients and so forth. But in terms of this topic that you are looking at, caring for the carer, who exactly are the carers here? Who exactly are the carers?
Yeah. I think now we need to get to a point where we appreciate myself that, I mean, everyone who currently has a job, they're actually a carer, simply because
Exactly.
they care to any other customer by providing whatever service they bring to them.
Mm,
If
yes,
I walk into a restaurant, that person actually cares for me because, one, they have to make sure that I'm safe in their restaurant. They have to
exactly.
make sure that I get the proper meal. And then over and beyond, like I said, there's a sector that is very often ignored when you talk about occupational health issues or when you talk about employment or issues that concern the employment. We have our house helpers. We have those that
Mm,
we have left back home, who cares for our cattle or for our livestock and the like. Those are
mm,
carers.
mm,
So caring for carers now, all it's saying is, as long as you have asked for service from someone, it's
yes.
your responsibility now to make sure that their health is of priority to you now. Gone
Mm,
are the days when we never had issues with this pandemics and the like, where I
yeah.
knew what my house helper, I can have a house helper for 20 years who never gets sick or whatsoever. Or as long as they're in my house, I don't believe they can be exposed to anything or
Mm,
any eventualities, medical eventualities.
mm,
But nowadays we appreciate that somebody just living their home, they're actually exposed. So in this instance, everyone that we know we've put in whatever place to provide a service, they're actually now a carer.
exactly, exactly. Very good. Everybody that you have put in place to provide you with a service is a carer. Not necessarily they have to be from the health sector. Whoever that you put in place to provide you with a service is a carer. They are caring for your customers. So measures have to be put in place to make sure that we care for them as employers. Thank you very much, Tabo, for that. Now, let us look at this one now. You've talked about the importance of, employers having to have in place the occupational health and safety, system in their program in their workplaces. So let us look at this. Like, what do you think, like, in the nation of Botswana and other nations, like, but let's focus in Botswana, the program that is there already, do you think is enough? What can be improved? Or also us as the citizens of the nation, what is our role in making sure that we comply and
Um,
adhere to what is provided?
Yeah, I think that's a very interesting question myself. I actually got this question on one of the radio stations sometime last year. You know what I'll say? I think what I'll say, given the numbers, I'll say as Botswana, yes, of course I can. I will say it's not a question where we can gauge to say you're doing enough, you're not doing enough. Simply because all nations are actually trying to survive. Look, who actually came out clear to say lockdowns are no longer an economic ways to manage this COVID, but we still have your other countries, your UK and the like, that are actually on lockdown. Just coming close home here, Zimbabwe is on lockdown. So it's just a matter of who's trying to survive as at present. But now as a country, I would say I believe we're on track. It might not be enough, but I believe we're on track. The question is, why am I saying I believe we're on track? If you look in the Southern Africa region, as at current, we actually have the lowest mortality rate. Yes, I know we can't compare ourselves to other countries, but given the fact that we actually have the lowest mortality rate at 0.4%, followed by obviously Namibia at is it 0.8. And you look at the number of cases that you've had. I think the only people that have lesser numbers than us is actually what? It's Lesotho and Swaziland. Lesotho have had a total of roughly around 6,000 cases. We have had a total of around 16,000 cases. But in terms of the deaths, we are actually at 50 something, still far off from the 100. I would say as a country, we are doing all that we can. We're actually on track. But then again, like you asked, what is it that we need to improve on? I spoke about the issue of adherence versus compliance. I think now the biggest problem that we have is that uh, majority of people, majority of organizations and individuals, we actually do things for compliance. We do things so that I can get by with the law. We don't do things for adherence. Compliance will help you to get by with the law, but not with COVID. Adherence will actually help you not just to get by with the law, but it will actually help you to get by even with COVID. So I think that's what we need to do. One, as people, we need to start adopting that culture of maintaining a balance between adherence and compliance. And then probably as a government, or as the people in the forefront on behalf of the government, I think what we need to do, we need to start intensifying on the education, where we have to educate people about why do we want you to properly wear a mask, not just wear a mask. We need to start educating people, because remember, if you are informed about something, you have better chances of making better decisions, unlike when you make decisions about something when you are misinformed. So the same thing applies. If you're informed about something and somebody makes a decision for you or on behalf of you, you'd actually better understand and better act on that decision, because you actually have the information to understand what's happening. So I think these are the two things that we actually need to work and improve on. As a government, we need to work much on educating people. We need to work much on educating people about COVID, about the importance of adherence versus compliance. And then coming down to us, as a people, we need to adopt that culture of maintaining a balance between adherence and compliance, and stop just doing things for the sake of getting by with the law.
Great, great stuff. I like the point where we talked about, your adherence, that we need to start doing things now, and But what I just want to know is now, for somebody or for that employer who hasn't been having the occupational health and safety program in their workplaces, where do they start? Like, is it going to be something of COVID or what? Do I have a choice as an employer to say that no, I'm just going to do this just because of COVID for now? Or are we saying now this is the time for people now to see that indeed occupational health and safety is a must? Do I have a choice as an employer? And what does the law say?
Like I said, Masawa, I don't think nowadays it's a matter of an individual choice. It's no longer an issue of an employer having to make a choice about what they are going to do and what they're not going to do with the current situation, where as a nation we're actually battling to survive. Even beyond battling to survive, even our businesses are actually battling to survive. So we don't have a choice. I think the best thing that business owners and corporate leaders need to do. We need to shift our mindset. We need now to adopt or to start implementing the occupational health in our workplace. We need to bring. That's where we need to start. We need to bring in people that are really trained for the job. It's very interesting because as we walk around, you get into some organizations, you'll be told that we have your, what do you call this, infection control person or specialist. You have your occupational health personnel, but then you get to interrogate that background. You're only going to realize, oh, okay, they do have probably a health background, but is it sufficient for them to be able to make proper recommendations for you? So I think where employers need to start, they need to start appreciating that the only way for their businesses to start, they need to start protecting their business. And start protecting their business, it's appreciating that we are faced with a health scourge. They need to seek, they need to appreciate that they need to start having occupational health departments in their organizations or businesses, or bring in people on either on consultancy basis to come and assist them, put proper measures in place and advice in a proper way.
Very good. Thank you very much. Toolbox Talk with She Masters. We are talking about caring for the carer. The carer being anybody that you bring on board to provide you with a service, to look after your customers. That's a carer. They are faced with the responsibility of looking after your customers. Therefore, you too, as an employer, you have to have the responsibility to be looking after them. Share our program today, our episode. Start watch parties. Feel free to like and invite as many friends as you can. We are moving on, Tabo. Now let's take this. Now I'm an employer.
Yeah.
Who has employed a house helper at home. I want to understand now, what is it that I'm supposed to do to make sure that I provide the care that my carer needs? I need to support my carer as far as occupational health and safety is concerned. What am I supposed to do? How can Stockford Health help me to ensure that I provide the necessary the measures that I need to start to provide for my carer? What do? I have no clue. I really don't know anything. This is a risk for myself and also for the people around the carer, the ones that he is providing the service to. What do I need? I need advice from Stockford Health.
Yeah, it's actually a question that we get quite often. Huh? But like I said, Masako, where we need to start appreciating that everywhere where you live, someone who's going to provide you with service, and and providing that service, or you engage them to provide you that service, you are their employer. So as much as when we get to work, we've been talking about our employer making sure that one, we have the proper protocols in place. We have the proper PPE where there is need. Like if you get into our offices, the people that clean and cleaning now, we have provided them with gloves. We've provided them with what do you call the surface detergents. We've provided them with masks. We've provided them with uniform. That's where we need to start, even at home. We need to start by providing our helpers with the proper or necessary PPE. We need to start buying gloves for our helpers. We need to start making sure that they have the proper masks, they have the proper uniform, to avoid a situation where I'm going to have probably 20 guests walking into my house, and then she has to serve all these 20 guests with tea, put on whatever clothes that she's putting on, and then after that she's gonna walk across to her house with the same clothes that she was putting on, and actually not knowing that what my guests or what risk my guests might have put her under. I think that's where we need to start. We need to start trying to duplicate that which we do where we are employed onto where we have employed people. And then on how Stockford Health can help. As Stockford Health, we have an email, which is info@stockford.com. We also have a Facebook page where they can actually contact us. We provide a wide range of occupational health services, starting from your consultancy services. We go to an extent of actually conducting those health risk assessments and compiling those reports that can actually guide you on what exactly that you need to do. And then the other thing that we did, or that we introduced since the COVID started, we do what you call, like, we make tailor-made um, COVID-19 response packages for organizations, for companies, or for individuals. We're going to come and do a risk assessment and then actually advise, specifically looking at your environment, what measures you need to put in place and what you need to do or how to go about it.
Yes, Tabo, thank you very much for that. So I just want to understand again. These are the questions that I believe that Motswana Kagai or whoever that is watching might be having. So as an individual, can I just come to Stockford and say that I just want to do the tests? As an individual.
Can you come again, Marcel?
I was just saying, as an individual, can I just come to Stockford and do the tests that are done? Like you've talked about the medical exam, like the pre, the post, and the exit medical exams. Can I, as an individual, come forth and say that I just want to do this test, or do I have to come through a company, or what? I don't understand it there.
Okay. What normally we do? We've been working mostly with companies. Why? Because, like I said, the test that we do, we actually run two clinics. So these two clinics, they're actually occupational health specialized. So mostly we work with employers, but then again, we still have people that come on individual basis. Let's take for example, you have to go to school, you need to do your medical examination, or you want to go for a site visit at place X where they want you to have done the medical examination. In that instance, you can just walk into our place, or we make a booking, and then we're going to have to sit with you, obviously, to assess. Because look, with occupational health, it's not just a matter of just doing the tests. With occupational health, we have before we do the test, we need to know which test exactly that we're supposed to do. In that instance, we have to do what you call the occupational health risk exposure. That is, whatever place or whatever job that you're going to do, what risks might you be exposed to? And that way, then we'll know what test to do on you. So yes, you can actually come, and then we're going to sit, have a conversation with you, and then better advice to say, okay, given the risks that this particular job is going to expose you to, these are the tests that you can do. And then we take it from there.
Lovely, lovely, lovely. Thank you very much, Mr. Tabo. This was really awesome. It was really informative indeed. Um, our fellow viewers at home, thank you very much for joining us. We were talking about, caring for the carer from an occupational health perspective. And what I got from Mr. Tabo is that occupational health, when we talk about the carer, we are not only talking about somebody who is, we are talking about everybody who's looking after customers, whether you are at home, whether you are a small business, whether you are a large business, where you are, as long as you are looking after people and you are tasked with the responsibility of providing that service, you are a carer. Therefore, your employer has the responsibility to make sure that they provide you with the programs and the services, or whatever that you need to ensure that you also are being taken care of. But again, Mr. Tabo, I believe that it is also the responsibility of the carer himself or herself to ensure that they also take care of themselves. When they are given instructions, when they are given programs to follow, indeed they have to follow them, because the employer can provide whatever they provide, the services that they provide. But if the carer does not practice what they have been told to practice, in a good manner, then it is actually a waste. So it was really nice having you. I don't know if you have any last word to say to our fellow viewers. This was Toolbox Talk with S.H.E Masters. Are your last words in conclusion, Mr. Tabo?
All right. Let me say thank you also for such an informative engagement. But my last words to my fellow global citizens is that let's get to COVID, it's let's appreciate we're all fighting COVID, and it's
Yeah.
an every individual's responsibility to make sure that we defeat COVID. Let's work hand in hand with our employers
Mm.
to make sure that one we provide them with guidance. Look, they're as much confused as we are, but wherever we have whatever little information that we have, let's also get to appreciate that it's our responsibility to make sure that we guide them so that we can protect ourselves against this COVID. We can protect our environment. We can protect our workplaces. And the other
Mm.
important thing as well is that please let's work to adopt the culture of maintaining a balance between compliance. Let's not just do things so that we get by with the law. Let's do
Mm.
things so that one, we manage to get by with the law, but most importantly, we manage to defeat the COVID. And
Mm.
also, probably let's work to adhere to the COVID-19 what do you call this guidelines that are put in place so that we can be able to defeat this COVID.
Mm, lovely. And like you said, just to add on just what you said there, Tabo, is that when you talk about the culture, we think the good part about the COVID is that it has shown us that indeed occupational health and safety is something that we really need to adhere to. We really need to to take into consideration. So when talking about the culture, it's not only about COVID. It's even beyond COVID. We need to make sure that occupational health and safety is taken as a lifelong practice. Thank you very much. Thank you very much, Mr. Tawa. I cannot thank you enough. I thank Stockport Health for for your representation, and I believe that we'll get a lot of people coming to you asking for more information and for assistance on how to implement the occupational health and safety program, and how you can assist them with the assessments and so forth. Thank
Yeah.
you, thank you, thank you very
Yes.
much. Thank
Um,
you very much.
I nearly forgot this. So they
Yes,
can
please. Oh
contact
yes.
us on 33974 578, or they can visit our clinic in Gaborone by Village next to Jack's Gym
Mm,
by Village Imaging Center. And then our head office is also in Fairgrounds uh, by Medical Muse Unit 2,
mm,
plot 50667. We also have another clinic also in Janin. By calling that number, we can provide the directions or the necessary directions. We also have a Facebook page called
mm.
Stockfort Health. They can also email us at info@stockfort.com.
Mm, great stuff. They have to start now, guys. You have to start now. Viewers at home, you have to start now by liking Stockport Health, Facebook page, and sending them messages. They'll respond as soon as possible. Thank you very much, Mr. Tabo. Thank you very much. This was Toolbox Talk with She Masters, where we were talking about caring for the carer, from the occupational health perspective. Thank you very much, viewers at home. I believe you have benefited a lot, and we look forward to seeing you again next week. Make sure that you share the video with your friends and family. If you're going to be watching this as a recap, make sure that you send it to a lot of people you invite. We are here every Tuesday at 6 p.m. From me, your host, Master Kolekoe, I thank you very much. Goodbye.